So my opponents mentioned that safety isn't really a concern on the road just because we have safer cars. That we can lower the drinking age because we have safer cars. We shouldn't worry anymore because these kids wouldn't die. Or it would be less of a problem. When in reality, that's not true. How do safer cars actually make the drinking age, lowering the drinking age acceptable? Does that mean that we're going to have walking tanks in the car on the road now because we allow these kids to drink now? No. Safer cars is not an excuse to lower the drinking age. It's not at all. Another thing that they mentioned was that it does not affect the brain development at all. That these kids didn't experience anything, but a study conducted by the National Institute for Alcohol Abuse stated that they conducted a study among adolescents and adults, and that short-term memory was affected. That these people who were heavy binge drinkers between probably the ages of 16 to 21 had lost some short-term memory, and that some of these people were actually experiencing alcohol withdrawal symptoms while they were conducting the studies. Now, again, as I stated, that our opponents also stated earlier on that it's not really working at the moment and we should just amend it because it's not working, because there's all these underage drinkers already occurring. Why don't we just lower it? Well, the minimum 21-year-old, a study conducted by the National Highway Traffic and Safety Agency showed that the minimum 21-year-old drinking age loss prevented an estimated 4,441 drunken driving incidents in the last 5 years alone, according to a new report released by the National Highway Traffic Safety Administration. That means that this is working. Now, our opponents also argued that because minors still drink and purchase alcohol policy doesn't work. After a study conducted by the American Medical Association, the evidence shows, however, that although many youth still may consume alcohol, they drink less and experience fewer alcohol-related injuries. Now, another report by the National Highway Traffic Safety Administration estimates that raising the drinking age to 21 saves about 800 lives per year. So it has shown to make a significant impact. In fact, most public health groups, including the Centers for Disease Control and Prevention and American Medical Association, are for keeping the drinking age at 21. Now, our opponent early on said something along the lines of, if we're 18, they have the right to have sex. Now, if we lower the alcohol age to 21, there's going to be a lot more risk, there's going to be more cases of sexual assault and high-risk sex, meaning unplanned pregnancies and rapes. In one survey, approximately 10% of female high school students reported having been raped. So if we lower the drinking age to 18, where the majority are in high school, how much more would the number increase by? So research has suggested that alcohol was used by the offender, meaning the rapist, the victim, or both, or the victim in this case, meaning that either the assaulter or the victim was inebriated. If we do lower the drinking age to 18, we will have many unforeseen effects along the lines of our teenagers. Thank you.